Hello everyone, this is Dr. Pooja Halankar from Goa. I have done my BAMS from Gomantak Ayurveda Mahavidyalaya, Shiroda, Goa, and I have done my MD in Panchakarma from KL University, which is situated in Belgavi, Karnataka. So this is the first video on my channel, and on this channel I want to post videos which will be related to Panchakarma. Some concepts of Panchakarma will be simplified, will be explained so that they are better understood by the students, and also some points of discussion, some clinical case presentations or discussions which will be open for all the practicing doctors and others in the field. So the main motive is just for connecting all of us together and discussing things. It's for the healthy growth of all of us in the field. So this is the main motive. So since this is the first video, I have taken up a very lighter topic. It is not related to Panchakarma, but it is something basic. Okay, there is a fresh batch which has passed out of BAMS preparing for the MD now. So I'm basically not from the career guidance, but depending on my experience, depending on what I saw my colleagues doing, depending on all this, I would like to speak about a few things. Maybe the students have a better idea about a few things, those who are preparing for MD. So just an outline of how your MD life is going to be. So 95% of us after passing out from BAMS, we go and opt for MD. Of course, there are different reasons. There are people, maximum of us, who want to join into hospitals, go into teaching because they like teaching, and many of us also choose MD, especially clinical subjects, so that they have a grip on their practice, and they come in contact with more patients during the 3 years of MD, and they have more confidence in treating their own patients when they will be putting up their own clinics, because maybe sometimes they don't want to go into teaching. So those of you who have decided that they are going to do MD, they must have done a homework with your seniors already, that to check what is MD life like, what you have to do, which is a good subject, which is not good subject, which colleges should you choose, what you should do, how you should study, all these things. So that is totally depending upon your interest. All the subjects are related to Ayurveda. Only thing, in whatever you are interested, you should choose, and also depending upon what you're going to do next, whether you're going to teach, whether you're going to have a clinic of your own. So depending on that, you can choose a subject, whether it should be clinical or non-clinical. There's nothing like clinical is good or non-clinical is good, this is bad, that is bad. It's nothing like that. It is totally upon what you like to do, so that you can focus yourself in that subject further on, because in future you are going to teach that subject either, or you're going to practice in that subject. So it is totally depending upon you. Also, the second focus which is there while choosing your subject is wherever you're going to do your practice, or wherever you're going to do work, what is the scope for that subject if you're looking out for. For example, if you're going up to teaching, sometimes we also inquire whether there's a saturation in that subject, because if you're planning to become, for example, XYZ subject, I don't want to name any subject, and there is already a saturation into the subject in your area, or the areas where you prefer, or where you can go for teaching, or where you can join. So maybe you don't get a chance, or you get a chance very late for joining into the college, or there's a little bit of struggle, and then waiting for your vacancy, you have to start a clinical setup and see patients. Maybe you were not prepared for that, so maybe you go into a little bit of depression because of this. So you always choose smartly according to the scope also, but at the same time you have to see that you like the subject. You're not forcing yourself to do something just because it has a good scope, but you don't like the subject, and still because of scope you're going for it. You have to balance out things. You have to just make a small study on that, and then choose. Also take an opinion of your seniors, and obviously you will be talking to your family about it. So once you choose MD and you have answered your entrance, you have got into the college, then those 3 years are yours. The next 3 years in the college, you have the college setup, the hospital attached is there, and you have a full exposure to the patients, so that you can study in your way. There are no restrictions. Obviously, there are rules of some colleges that if you want to go and see the patients of a few departments, which is other than your departments, maybe you'll have to take permissions of the consultants or something like that. But you're always welcome in your institution to go and learn something. Okay, these are the 3 years after BAMS where you will be having more time for your practical things rather than your theory. So you will be obviously going through your theory, brushing up your theory, whatever you studied. Also your subject you will be studying more deeply and more in detail, but you will be having a lot of time to go practically, like handle the patients, see the treatment protocols, get the treatments done. You will be seeing the OPDs for more time. At this time you will be seeing the different consultants, how their line of treatment is going, how they are treating the patients. Your development of the mind in a clinical way is going to happen. So you have a more grip over the subject, over your practice, so you have more confidence in treating the patients by yourself. So all this you have to develop within this 3 years. So you have to keep in mind that you have got another chance, another 3 years, in which you have to now the foundation of BMS which you have already got, with that you have to build up in such a way that you have to learn everything which is coming your way, everything possible, because after 3 years you're going to be on your own, as we say, and then you have to build your own practice. So whatever you can absorb, whatever you can learn, how much time you can put, you have to put during the 3 years. Okay, so in 3 years of MD there are theory classes and practical classes like we have in BMS, but we don't have that much duration. Like in MD we have maybe 2 to maximum 3 classes of theory and practical in a day, and the remaining time goes into other activities. Okay, so the other activities are like very first thing is, if you are a clinical person and you have duties in the hospital, which is into the OPDs and the IPDs, your department consultants will be there. They will be seeing OPDs, so you have to be with them. You will be seeing patients the whole day. Then you have to once if they are admitted in the IPD, you have to follow the treatment. You have to get their treatments done. You have to take rounds daily. So in this process, you also learn a lot of things. You learn to handle many of the common cases which are coming in Ayurveda, and this is going to help you a lot in your further life. Okay, so this is one thing. And those who are not non-clinical, they are also always, at least in my college, they were always welcome. They used to come, they used to learn, they used to take rounds. Even if they did not have duties, it is their college, the hospital is always open for them, so they can see the files, they can see the patients, they can also follow the treatment. Okay, there's a lot to learn always in MD. Depending upon the subject, you have your own things to learn. And apart from this activity, the other activities are, you have to take theory classes and practical classes for your juniors. Like if you are a Karachikitsa student, whatever topics have been done for you, maybe the next month you will have to take a class on one of those topics for the UG students. Or if you are a second or third year MD, you can take a class for the first year MD students. So it depends upon how the timetable has been given to you. Like for example, in our college, we used to have 2 to 3 theory classes for each of the PG student to be taken for the UGs. And we also used to take, since I was a Panchakarma student, so we also used to take Panchakarma practicals for them. Like if the UG students are having Nasya and Basti this month, so one PG student takes Nasya this week, practical. Next week somebody else is taking Basti practical. So it is divided and given to the PG students. Even the consultants are also there. Under the consultants guidance, obviously they want to take classes for them. And this is one more activity. So apart from this, the third activity is, the biggest one is the seminars. Okay, now seminars are a major part of MD. There are many benefits which I'll be telling you, but there are 2 types of seminars. Like you have departmental and you have general seminars. Now in seminars, there is a topic given which is always related to your own subject. Sometimes for general seminars they will give a general topic, but your departmental topic is given, and it is presented in front of your departmental juniors, seniors and consultants. Okay, and they are going to ask you questions about it, and there will be discussion, a healthy discussion will be there. And so whatever topic is given to you, you will be studying it very well. You are going to explain things to other people from your department. So they also will be learning about the topic. So there is a certain kind of growth in this pattern. So everybody is given one topic. So in every week you will have at least 2 seminars presented by the students. And there are others which will be general seminars. In general seminars, you have a topic which is given to be presented generally in front of all the departments, in front of all consultants, all teachers of the college. It is preferably kept in the hall, in the auditorium of the college. So there you have to be even more specific, even more from the base level you have to give the knowledge about each thing, because there are students from all the departments, so you have to make everybody understand about your topic in a simple way. And also when they have doubts, they will also ask you questions, you need to reply to them. So again, you have to do the topic very well. There is a panel who is going to judge you on this, a panel which is appointed for the general seminar. So they are going to rank, give you marks or give you a grade kind of, whether you have done it well or whether you need improvement, in your presentation skills, or whether you were falling short in explaining the subject properly. All these things, how is your answering skill, all these things are checked. So at the beginning, first 1 or 2 seminars, you will be always nervous. It is always new for everybody. Now there are seminars, in fact, going on in BEM as in UG level also. At our time we did not have so many seminars in the UG level, so we had actually no idea about how to make PPTs and how to present them. So there is a lot of advancement now in UG itself. People are making presentations, so it will be easy for this generation to continue it. It is just a little bit on a higher level. You will have to go in a little bit of a more detail and present it a little more better way. Now, what are the benefits of these seminars? Very first thing, it is giving you a lot of confidence. It is eliminating your stage fear. Okay, and if you are going to be into teaching in your future, so obviously it is giving you a base for you to prepare yourself. You're preparing for the topic, you're preparing about how you're going to explain it to the people, you're preparing even for the questions that are going to be asked after explaining the topic. So all these things which is normally happening in class, when you're teaching a class, a subject, you prepare for it, then you go and teach them in the class. Obviously when they don't understand, they will question you, so you prepare for answering to them. So this is what builds confidence in you, so that you can teach in your future. Second thing, the confidence which is confidence of presentation. So when you're confident about yourself and you present very nicely, this comes only from the knowledge. So you are reading so much about the topics, you're making your knowledge so strong that you don't hesitate while talking. So you should work like this on every topic which you're going to talk about. Never talk about any topic with half knowledge. So this is what seminars are teaching you always. And you have you're developing a skill of answering, and a lot of things you get, and there is a lot of growth with the as when you keep seminar as a medium in this whole 3 years of MD. Okay, also there are seminars which have to be presented outside your college. It is national and international seminars which are organized by different colleges. So in our college we had compulsorily 3 national and 2 international seminars compulsorily we had to do, and they may be organized by your college or maybe outside. So you have to prepare a case presentation or some topic. Obviously it is related to the topic of the seminar which is going to be conducted over there. So they give some topics on which you have to make the PPTs. You have to take it there, you have to present it there. It is the same procedure. There will be a panel who is going to question you 1 or 2 questions, and there's a time limit over there because there are many people presenting from all over India. So they give you a certain time limit in which you have to present your paper or your presentation, and there are also prizes for the best presentation for that. This is a different kind of a platform. So many of the UG students have an experience about this also, because now they attend seminars in their final years and during their internship. Okay, so you need to have these certificates. They give you a certificate that you have presented the paper, or you have come as a delegate also. They give you the certificate. So these certificates are necessary for submitting during your final year, and they have made a compulsion. So you have to complete a certain number of external seminars, national and international, for completion of your MD. And apart from this, there are colleges which have other activities such as medical legal cases are there. Then there are clinical case presentations, which are presented mostly in our college. It was presented by our lecturers, our consultants. So these are activities which increase the knowledge again. There are different kind of rare cases which are documented and presented by the consultants. You go and attend it, you get more knowledge. Medical legal cases, many of the medical legal cases which are there, they teach you what you should do, what you should not do, the importance of documentation in your practice. All these things, small things, which maybe now they will be bounces for you, but maybe later on you will understand as you do your MD. Okay, so these are all the activities which are apart from your theory classes and your practical classes. Now the exams. Okay, you don't really have to worry about your studies, about theory and stuff, if you are actually concentrating on your in your department, because whatever you're doing in your department on daily basis, 50% of that is what your subject is related to. So there's a very little to study when the exam time comes. Okay, for example, in Panchakarma, if you do dedicated duties, if you see all the patients, if you see why the procedures have been given to the patients, how the patient is reacting to it, how you're doing the procedure, if you're going in the preparation room and seeing how the medicines for the procedure have been prepared, all this if you observe on daily basis, and if you are really into it, at the end of the year when you have to study for the exam, you are having the same things in the books. Like what are the preparations, how much is the quantity, what are the indications, when it should be given, when it should be not given. So you are 50% prepared for the whole thing. So same applies to the other subjects as well. And the exams are at the end of first year MD and at the end of third year MD. So there are two exams, MD1 at the end of first year, MD2 at the end of third year. So in between this, according to the colleges, they may keep exams in between for you, like preliminary exams for your preparations or some tests in between. Okay, so that is the thing. And one very important thing is your dissertation. So about the dissertation, there is in the first year when you join, after about a month or so, during the first 2 or 3 months, you will have to choose your topic. Now the topic is again, it will be within your department. Obviously there are you get to choose topics beyond that, but mostly it is within the department itself. Okay, and there will be areas given to you. Like in our college we had areas, like 4 or 5 areas, and each area of the subject was given under one consultant. So if you choose areas, as in I'll give you an idea, like there is Snehan Sweden is one area, okay, Vaman Virechan is one area, Basti and Nasya is one area. So if I have to do something in Basti and Nasya and I choose that area, so the consultant who's taking care of that area is going to be my guide. So and then further you have to do what you have to tell what you're going to do in Basti and Nasya, on which disease are you going to work. This is for the clinical thing, if you are doing a clinical trial. Similarly, there are other kinds of dissertations, other kinds of topics in non-clinical or in other subjects. Okay, so I can speak more properly about clinical trials because I have done these kind of things. Okay, so in clinical trials, what we do is we choose a topic first. Like I had chosen sciatica. Sciatica was coming for me under Snehan Sweden. Okay, so then next they asked me, what are you going to do in sciatica? So I said I want to make a treatment protocol for sciatica patients. So then they ask you, what new are you going to do, because there is already we are treating sciatica patients. So you have to find out, you have to research all the books where what in classics is given for sciatica treatment, and what new are you going to do. Okay, or whatever treatment is going on in the hospital, what new are you going to do for the benefit of the patients. So what will be the purpose of your study, that is to be told here. So you can say like my topic was in classics, it is given that you have to do Koshta Shodhan, that is by giving Nitya Virechan, so that your Koshta is cleaned up, and then after that you have to start with your Basti treatment, so that it gives better results in sciatica. In hospital protocol where the data had gone and checked, they were not doing the Koshta Shodhan for everyone. Basti was being given, and there were external treatments like Kati Basti, etc. were given for sciatica. So I made a protocol with the help of my guide and with the help of my principal, where I would introduce first the Nitya Virichan, that is Kostashodan. After that, give the Basti and then see the result. And there are two groups always to see whether what you're doing is working or not. There is a control group where you give the treatment which is already going on as usual, whatever is being given in the hospital, and your trial group where you're doing your new trial, in which you will put a protocol which you are going to do, like Kostashodan first, then Basti. So there are equal number of patients on both the sides. Like I had 30 patients, so 15 patients in the control, 15 in trial. After doing that, there are certain parameters how to assess. Like you have to assess the beginning of the treatment, you have to assess the SLR of the patient, how much is the pain percentage, and all those 4-5 parameters are there. And again in the middle of the treatment and at the end of the treatment, so you get to calculate what is the improvement percentage. So you see in the trial group, you see the control group, and then you find out whether your protocol is working or not, whether it is better than the control group or not. So your study has a positive result in the end. So this is all about the dissertation, whatever you have to do in the whole 3 years. So there are parts of this, like when you choose a topic and when it becomes final, when they allow you to take it, once your topic is finalized, then you have to finalize in the department first, okay, and then you have to present something called as the synopsis. Synopsis is a very short outline of your thesis. It will only have your topic name, purpose of that, and very short outline on how you're going to do it, how many patients you're going to take, what treatment you're going to give them, how many patients will be there in control, how many in trial, what medicines will be given, all these outline details, okay. So this synopsis has to be presented in front of an ethical committee which comes to the college. This ethical committee is making sure that whatever treatment you are planning for those patients is not going to harm them, okay. It should be safe for the patients. So whatever treatments you are telling should be written in the classics, should be in practice from a lot of years. It should not be something new. So they are checking on that, and if it is like that, if it is safe, then they are giving you permission for that, okay. So once your synopsis is approved, then you can go further. If it is not approved, if you have some new things, if you're making some new kind of labor which is not already there in classics, then they tell you to do the animal trial first. So animal trial means they will give you some albino mice, albino rats and other animals. On them you have to try your medicines, and then you have to go further on human trial. So there is a process which you'll come to know later. After your synopsis is approved, and then you have to go further for your for the patients, okay. So whatever you have planned, the medicine which will be required is procured all at the same time. For 30 patients, I needed around 90 packets of Basti. So we have some Basti packets bharad. So all 90 packets I had to take at one time and store them into. There is one place in college they give you for storing that. So you cannot do any bias with that. You cannot get any medicine from outside, because all should be of one type of medicines, because the results will be shown in that patients will be depending on the medicines. So all medicines should be from the same batch. So you procure it once at a time. Again, you have to randomize, you have to choose 30 patients. So every time when one patient comes, if he is of sciatica, you have to ask permission to your consultant whether you can take him for your study. If your consultant is okay with it, you have to explain it to the patient. You have to tell the patient that you are giving the treatment free of cost, because he is becoming your subject. He is helping you in your study actually. So you have to give the treatment free for him, and once he is okay with it, once he gives you a written signed consent, you can enroll him for the study. And whatever you are giving, time to time you have to note down what are the changes taking place and all. Like this, you have to complete all the subjects. Like if you have 30 patients, for example, all 30 patients you have to complete. For this you get a period of around 2.5 years, or maybe in 2 years it is best to complete. Side by side you have to do the theory work. Like your subject is, like my subject was sciatica, so I have to do literature work on sciatica from all possible granthas. I have to collect the information about sciatica, collect the researches which have been there, then whatever drugs I am using in my study, about those drugs, about the treatment protocol of sciatica, about Nitya Virechan, about Basti. If it is Erandamol Nirobasti, about Erandamol, why it is given in sciatica. All this literature you have to collect, you have to write it down very nicely in a format, and this is going to make your whole dissertation. Okay, so along with the theory, daily a little bit of work you have to do in the library. You have to do your you have to see your patients also. Along with this, you have to manage your seminars, your general as well as departmental seminars, your classes and theory classes and practical classes, your teaching also. You have to, means all these things all together you have to manage. Very first 6 months become a little bit difficult, but then afterwards you get used to the routine always. Okay, along with this, in the final year, when there are maybe at the beginning of the final year, you have to finish almost finish your dissertation, because there is a further process to this. Then after finishing, you have to give a final presentation about your thesis, what you did in these 3 years, and what is the result that you have got. And then after approval, it will go for the final print. There are around 6 to 7 prints of that, which of 3 of them go to the university, 1 goes to your guide, one remains with yourself, 1 remains with the library of your college. So there are some copies of that. Okay, once the dissertation is submitted and a whole lot of work is over, then you have to start preparing for your exams, final exams. So this is the whole thing. One more thing I forgot, after every 6 months we used to have a review, that is, what is the progress you did in last 6 months, apart from the whatever duties were given to you, apart from your seminars, what is the extra work that you have done, how much you have progressed in your study, in your dissertation, whatever you are doing. All these things, they do a review in every 6 months, so that to see that you are on track. Okay, so this is one thing. Okay, and there are many things, depending on which college you are studying in, there are many things which changes from college to college. Like we were PGs in Panchakarma, so we had a lot of things to do. Even we were told to look after the stock of the like the stock of the oil and the stock of the medicines in the Panchakarma department. We were told to write the cluster, which is like supposing there are 30 patients in the hospital, out of which 25 are having treatment of Panchakarma the next day. You have to write, you have to arrange the timings, because we give basti in the morning. So if there are 5 bastis, how you are going to accommodate them over there? Which therapists are you going to post for which patient? All this according to the time and according to the how many patients are there, you have to arrange, and you have to write it into a book which was called a cluster. Same cluster has to be followed from the next day morning, so that the timings do not clash. All procedures should be completed in time. And there were registers in which we make daily entries that was to be maintained by us. So when we were studying, basically sometimes we used to feel like, why this extra work is given to us? It is a clerical work, we are doctors over here, we are come to see the patients. So it was very frustrating sometimes, but after we pass out, we actually come to know that when we are starting our own clinic, at that time in our clinic we have to do this on our own. When patients start coming, okay, you have to maintain your appointments, you have to maintain the medical records. So you have to maintain for yourself, so that next time when the patient comes, if he has come without the prescription or if he forgets to take the medicines, you know what you had given, so you know what to do next. So they are so important. So if you pass out from institution which teaches you all this, you don't have to do something else. You're already disciplined in that manner, so that you are perfect in your practice. You know everything what to do in your clinic very, very easily. Okay, so these are the few things. Actually, none of these things are difficult when I'm telling it to you, because you have not experienced it. I'm just telling it to you. It may sound very difficult. It may sound very like a load. Like so many things we have to do together, but after a first few months, then you really get used to the thing. Make sure that you have the subject which you like, and you go with an enthusiasm to grasp everything and grab everything, all the knowledge which you get. So that should be your main motto. Exams and everything, seminars, everything will be going on with their own time. Everything will pass off very nicely, okay, very smoothly. Even your dissertation, always there are seniors. We had very helpful seniors in all colleges. Seniors are always very helpful, okay, because their seniors have also helped them, so they will help you. You have got to help your juniors. So together there is a growth in MD. your consultants are helping you. There is a guide. Depending upon your dissertation, you also have co-guides sometimes. Okay, so together you can always complete everything in time. Only thing, you should never get nervous, never get frustrated. There are times when you get frustrated, that there's so much of load, so much of burden, there is stress, but this is all only for those 3 years. Okay, so if you enjoy and if you understand why you're doing this, so that you have a better future after going from here, and this is the only time you're getting to learn. If you think in this way and you do, it will be the best. So this is something which I don't know if you feel if it is relevant or not relevant, but I hope some things of this which I have said is going to help you to set your mind or prepare your mind. Okay, and I wish all of you all the best. May you get the subject which you desire, may you get the college which you want, and may you have a very, very nice future ahead. All the best.